Graduates, today is your day of celebration. Today, your hard work culminates in the great honor of receiving your MD degree. Today, your family, your friends, and your community celebrate your dedication and your successes. Today, you officially join a most noble profession, the profession of medicine. Congratulations. By virtue of the credential you now hold, by virtue of your soon-to-be new title of doctor, people will turn to you at their most vulnerable moments. They will share with you, as with no other, the intimate details of their bodies, their darkest fears, and their deepest hopes for the future. They will literally trust you with their lives. This trust is a gift and an honor, granted to you by those you have taken an oath to serve your patients. This trust derives from great respect for you and your new profession. Treasure that respect, but always remember that it is a gift that carries great obligations. The obligation to use your knowledge to benefit your patients. The obligation to always put your patients' needs above your own and embrace the value of altruism. The obligation to be a leader in your community, to take on the responsibility to address all the needs of all your communities, both locally and around the globe. You are graduating in an unprecedented time of challenge for our nation and for our profession. You will practice in an era of tremendous change as we rise to address the urgent need to reform our healthcare system and achieve our mission of ensuring better health for all. It has been said that change does not roll in on the wheels of inevitability. It comes through bold vision, continuous work, and unflagging dedication. So as you accept your diploma today, as you accept this extraordinary gift of respect and trust, you are also accepting the charge to lead us in the change our country needs. Seize the moment. Use the power of your education to redesign our healthcare delivery system so that it is truly a health care system, not a sick care system. Use your knowledge to create a system that is person and family-centric, a system that highlights prevention and wellness, a system that provides coordinated care, a system that is safe, accessible, and affordable. Most importantly, embrace your role as a societal leader and work to correct the parts of the healthcare system that fail to serve the principles of social responsibility and social justice. The United States has led and achieved advances in medical care, from vaccines to transplants to DNA sequencing and more. These are extraordinary milestones of progress that we as health professionals and as a society can be proud of. But we cannot be proud of the fact that our country continues to experience unconscionable inequities in health access, quality, and outcomes. Our healthcare system remains inaccessible and unaffordable for far too many in our nation, and healthcare outcomes fall far short of what a great nation like ours should achieve. The United States spends more per capita than any other country on healthcare, and yet has tragically disappointing outcomes. Despite spending almost twice as much per person compared to other developed nations, we rank among the worst in indicators ranging from infant mortality to life expectancy. We must proclaim that this is unacceptable. Our healthcare system today is characterized by shameful health disparities, disparities on the basis of race, ethnicity, geography, sexual orientation, immigration status, and socioeconomic status. Your health status should not be determined by the color of your skin or the zip code in which you live. We must proclaim that this is unacceptable. As Martin Luther King profoundly stated nearly 5 decades ago, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And yet these disparities and inequities remain true today. Consider that African American women are more than twice as likely as white women to die of cervical cancer, or that people with less than a high school education are more than 4 times as likely as those with a college degree to report poor health. These are statistics, but their importance is in the lives of real people. Graduates, you learned about these realities during your years here at the University of North Dakota in your classrooms, and most importantly, in the faces and the stories of those you cared for in the hospital and clinics. You know that the need is urgent. The cost of inaction is no longer bearable. Robert Kennedy said, "Each time a man stands up for an ideal, or acts to improve the lot of others, or strikes out against injustice, he sends forth a tiny ripple of hope." 64 students are graduating today. Together, you can set in motion multiple ripples, and those ripples can come together as an uplifting wave to improve health for all. So how do you do this? How do you choose the ripples you want to make? As you embark on this journey, the answers will come, I believe, if you can discover and follow your own moral compass. To do so, you need to look inside yourself to identify and explore your passions, and most importantly, define your core values and use them as the guide for all that you do. Our core values define who we are, what we prioritize, how we use the opportunities we are given. Our life experiences shape our core values, and those values in turn influence the life path we choose to follow. For most of us, our core values are rooted in our childhoods. For me, it began in a home that was full of abuse and fear, and by the time I was 14, the choice was clear: stay and risk my life, or leave and learn how to survive on my own. So I escaped, running into the dark, just 14, scared and alone, uncertain where I would sleep or where I would get food to eat. And when a stranger gave me money to call a teen counseling center, I met people who found me a place to stay and helped me enter the foster care system. I lived in 4 foster homes. My first foster home was an emergency placement. And just as I was thinking maybe I could trust these people, it was time to go. And from this, I learned about how hard it can be for the vulnerable and abused to trust the system, to trust even those dedicated to caring. My second placement was with an African American family who, though not quite knowing what to do with this blonde, blue-eyed white girl, opened their home with kindness. And from them, I learned about race and equality and social justice. And my third placement was also with an African American family. They were welcoming, but I was wary. Then one day, I was doing the laundry, a load of whites, and I accidentally added a red sweatshirt. I was petrified. From my experiences growing up, I expected punishment and harsh words, and instead they said, "It's okay." And suddenly we were united by a common color, pink. From them, I learned about compassion and forgiveness. And my final placement was with a couple who became foster parents just to take care of me. And to them, I will always be grateful. They saved my life, and I learned that by giving of ourselves, we can give life to others. And so at 17, I aged out of the foster care system. I was on my own. I found a job, an apartment. I finished high school. I figured out how to pursue my dream of becoming a doctor. I learned about the importance of persistence and the power of having a dream. I beat the odds. People ask me today if my job as the president of the Lasker Foundation is hard. And I tell them that nothing is as hard as being 14 and being on the streets, struggling to survive. But in a lot of ways, I was lucky. I was white and educated. I had foster parents who took care of me, teachers who believed in me. But I saw a lot of kids who were not so lucky. Kids who were failed by the system, kids whose society was willing to throw away, kids who saw no future and therefore gave up hope. And from those children, I learned what really matters. From their teachings, my core values of caring for the vulnerable and fighting for social justice were born, and those core values have been my moral compass and have guided all that I have done since. I went on to complete medical school and my training in internal medicine and infectious disease, and then I entered practice. Just as a new, unknown, and at the time terrifying disease called HIV/AIDS began claiming the lives of previously healthy gay men, I saw young men who looked like old men, their bodies failing painfully and catastrophically from a devastating fatal illness. I saw them experience heartbreaking rejections, even as they were dying, from families and friends and work colleagues who could not accept that they were gay. I found myself working in a society and in a healthcare system that often rejected and stigmatized my patients, and here I found a community that I knew I needed to advocate for. I established the first HIV/AIDS clinic at the Minneapolis VA, where I was on faculty, and I fought for and supported those brave men. I will always be grateful to them, those patients that I worked with during those early years of the epidemic, because they taught me what courage is and that love and acceptance are ultimately more powerful than hate and stigma, that caring will always be stronger than rejection and discrimination. And through this work, I was given the opportunity to live my core values of equity and diversity and social justice that had been shaped by my early life experiences. So I share with you one piece of advice. Embrace your core values and define what gives meaning to your life so that you can know the right way for you to give meaning to other people's lives. Establishing the AIDS clinic, surviving on the streets as a teenager, those are the experiences that have led me to live every day of my life, serving one primary purpose, helping the most vulnerable people, the ones that society is willing to abandon. And for me, my core values are stirred to passion by the reminder that, as many have said, the greatness of a society is defined by the way it treats its most vulnerable members. This, I believe, is the essence of being a doctor, the essence, graduates, of your new profession. As you treat individual patients, always view their actions and our actions through a lens that looks towards the society in which they live. We must celebrate the goodness in our society and be leaders in addressing its failings. People will bring much more than health challenges to your office. They will bring the harsh realities of life, and their health issues will frequently represent symptoms of the disappointing inequalities in society. And this means to care for our patients, we must address system change. We must become involved in policy development and advocacy, and we must be community leaders who address these issues. So as you go forth in your careers, broaden your approach to a perspective that encompasses this bigger picture. Look beyond medical care to the underlying social factors that affect health and well-being. Raise your voice to educate others about what we know to be true, that health is determined only in small part, about 10%, by the care delivered in hospitals and clinics, that it is due in much larger part to the social determinants, factors such as income, education, safe housing, job opportunities, access to healthy foods, all the circumstances in which we live and work and play. Partner with businesses, governments, civic organizations to address these social determinants, these fundamental drivers of the health status of your patients. This is a big task, but it is one your time here at the University of North Dakota has prepared you to take on. The soul of the medical profession is filled with altruism, compassion, excellence, integrity, and honesty. These attributes are now part of your core values. This is your time to live those values, to drive new ways of thinking, to achieve important breakthroughs, and attain that ultimate goal, making people's lives better and society stronger, kinder, and more just. Today, you take a huge step forward on your life journey of service to others. You are the future of this country's well-being, and I am confident that each of you will help fill the world with hope and happiness and health. I ask only that you heed Harriet Tubman's call to action, as she said, "Every great dream begins with a dreamer. Always remember, you have within you the strength, the patience, and the passion to reach for the stars to change the world." Congratulations, class of 2014. Live your dream, change the world. Congratulations.